Right, welcome everyone to our Voluntary Action Forum on why neighbourhoods matter, looking at the VCS role in local care and health systems, or maybe that should be health and care systems. So first of all, as you've probably heard me say a couple of times, we won't have time for a round of introductions today, I'm afraid. So if you could introduce yourself in the chat. Bit of housekeeping. So the good news for me is that teas, coffees, toilets, fire escapes, that's all down to you. I don't have to worry about that. I've mentioned that we're recording today. Switch your camera off if you'd rather not be recorded. So that's our agenda for today. We've got Donna talking about the VCS perspective, Tom O'Gorman talking about the NHS perspective, Jessica Lawson talking about adult social care, and then that's me, Kevin Noonan. I'm going to just do a quick roundup, and then we're going to get into breakout rooms. So hopefully we'll get there quite quickly to give you plenty of time to discuss our three questions, which are: what are the opportunities for the VCS, health, social care, to connect people to activities and services? Other things that the VCS should do to engage with this agenda, and things that the VAC that we can do. So finally, we want you to tell us what we can do to help enable all of that. And then we're going to come together for a plenary and a Q&A, and we're going to be joined. So it's going to be the panel, is going to be the speakers, and we're going to be joined by Fran Group from the Community Partnerships team as well on that, so that if you have questions for them, she'll be able to address those. And what I'll do with the speakers, so we'll get going straight away, and what I'll do with the speakers is, if it's appropriate, I'll take questions after each one. We'll keep an eye on the chat. If not, maybe we'll take the questions at the end. So we'll see how that goes. So Donna Turnbull from VAC, you're first up.
Right, I'm going to share my screen, hopefully. Yeah, everyone see that? Okay, so, right, I can't seem to make that any bigger.
Top, bottom,
yeah,
bottom right.
The bottom one, okay, sorry. Okay, so my job is really to give an overview here, which will hopefully be filled in more detail by other speakers, and where the voluntary and community sector sort of sit in this whole change and introduction of new systems, I guess. So we all know big changes in health and social care, and a big focus on joining and connecting and people-centred approaches to health and social care that the voluntary and community sector are really implicated in through all the plans that have been developed a number of years now. So general idea: less transaction-focused services, more focus on population health, which is probably where the voluntary and community sector sort of can be really, really useful. So this is a whole system approach. So the voluntary and community sector is part of that system. So we have a voice in this, and that's very important. This isn't some sideline project. This is part of a whole approach. So this is my rather simplistic way of showing what this is, what this might look like. So we have neighbourhoods. Neighbourhoods different things to different people, but really neighbourhoods, that's where things happen, that's where the action is. So some people, their neighbourhood might be something very tangible around their community centre and currently food hubs, that kind of stuff. To GPs, it might be a primary care network, an area that is covered by their GP practices that work together. I don't think it really matters. I think everyone sort of battles with this all the time. I don't think it really matters. The neighbourhood is a sort of interactive ecosystem where people can connect with the things that they need to support their health and well-being in a very broad sense. So those of us who aren't based in specific physical neighbourhoods, you are still working across all these neighbourhoods, adding value to other things that are happening there. So these neighbourhoods, these sort of local sort of ecosystems, are part of what we're calling an integrated care partnership now. It is a borough level, and that is really the connectedness between health, care, voluntary and community sector, residents, and a whole range of other services and activities. So at node level, it's often more obvious where the voluntary and community sector are engaging. At level, there are fairly clear routes where the voluntary and community sector can have influence through different boards, different groups and meetings around those things. But then it gets bigger, what will be called an integrated care system. And that should appear for Camden in 2021. Currently, that's called the North Central London Sustainability and Transformation Partnership, and it comprises 5 boroughs. So that is what's known as the integrated care system. And there's loads of things going on here. Loads of groups, lots of voluntary sector involvement in different places. I'm sort of on a mission to try and map that so we know where everybody sits and who to connect with, and hopefully avoid doubling up, really. So all this is part of this integrated care system. Moving on. So in terms of participation of the voluntary sector and having some influence, over a number of, there have been all sorts of events, meetings, workshops that have been held by the voluntary and community sector or in partnership with the clinical commissioning group, with adult social care, with other parts of the council. All those things are kind of culminated in the situation we have now and these big ambitious plans and the system. So Action Calendar are involved in quite a lot of things around this. So we're also involved with national, regional, sub-regional organisations. And I put this in really just to point out, while this is supposed to be consistent across the country, with everybody having their integrated care systems, the experience from the voluntary sector gets quite different once you move out to Camden, really, or even NCL, Central London area. So there's a lot of work to do, I feel, at national level and in terms of NHS England and the way they perceive the sector. And of course, that comes down to us at the end of the day, sort of filters through. So other things that we do is letter and briefings usually contain updates on what's going on around this agenda. One of the things we're increasingly doing, and some of you will have been contacted by different organisations as well, and will have experience of this, is more and more signposting, information sharing and connecting with different parts of the sector. Lots of parts of the NHS and social care are wanting to find voluntary and community sector organisations where they have some synergies about what they're doing and how they're developing within this integrated care partnership and system. So that's a sort of growing area, really, and I'm sure we'll have more and more people tapping at your door.
1 minute, Donna.
What? A minute, sorry. I thought you were going to make a comment there. Okay, this is my last but one slide. So we use a lot of our case studies and stories around that to try and influence and tell the story of the sector. So we use data from the moment, COVID-19 response alongside voluntary sector profiles from the work we do with organisers, and of course social prescribing data from the care navigation and social prescribing model. And our direct also is quite a useful source of showing what the sector looks like in Camden. Current priorities or the focus so far has been support and resourcing for voluntary sector, obviously in proportion to expectations, and not just funding, but the way funding happens. It's not always appropriate to what is expected from the sector or how they can operate. Educating about and promoting the value of the voluntary and community sector around key themes. So all these themes were pre-COVID themes, but of course now they've been amplified and probably give us more indication of what needs to be done, where connections need to be made, and then relationships within the emerging integrated care partners and system. So getting voluntary sector input in the right places, so that big impact for things like health inequalities, linking those things up. And I'm going to finish there.
Great. Okay, thank you, Donna. So if you can stop sharing, and then we'll go straight into sorry. I think it's Tom, it's you next, isn't it? Sorry, looking at my running order.
Okay, can you let me know if you can see the screen?
Yep, that's perfect.
Brilliant. And I'll thank Donna for making half my points already. Stealing half. So what I'm gonna quickly do for 5 minutes or so is just give you a bit of an oversight, or a bit more of an oversight and understanding of the NHS's view of integrated care, and some of the structures that Donna's already alluded to, and just to say that I guess this piece of work really is a building on the long-term ambitions of the NHS's long-term plan to bring health and care and other partners together to be much more integrated and much more collaborative in the kind of support that we provide to our population and to our residents. And obviously the voluntary sector moving forward, we want to be a major part of that. Just keep an eye on time. So I think, as I said before, it's really about bringing together, NHS organisations, local authorities, and putting even more the person at the centre of the support that they are provided, wrapping services, particularly on that small neighbourhood basis that Donna alluded to, around the patients, to really join up the care and support and preferences that other services that are on offer to them. And there's a big drive to make sure that we're actually tackling whole population health issues. And so you'll probably hear lots of information about population health approaches, which I won't go into at this time because I'm not an expert. So bringing these together is about making sure, as I said, the person is at the centre of the care and support, that we understand, really grounded in not just what we feel the person needs for their long-term support and care, but actually understanding their preferences and understanding what they want to achieve in order to improve their quality of life, and putting the person at the centre of those decision-making processes, with those services wrapped around it. And as Donna's alluded to, people tend to live in a small neighbourhood. They get to know their neighbourhood and the services that are available to them, and so they want to understand how that group of providers and support mechanisms can work together to really empower them to have life-changing outcomes. I will move on. So, as Donna's kind of alluded to, this is a little bit more of the structure. So I won't cover it too much, but as in, I think Donna's second slide, she alluded to the idea that there are 3 levels to this piece of work. The first is the lowest level is that PCN, or the neighbourhood working. So it covers a smaller population of between 30 to 50,000 people. And we know, particularly in Camden, as well as other areas, that lots of services, whether it be GP primary care networks, whether it be social care teams, whether it be district nursing teams, they are beginning to group together into neighbourhoods, so that you actually get a kind of consistent offer within that neighbourhood for all those services working together to deliver real change, different care and more coordinated care for patients and for residents. And then you've got above that, you've got the kind of the Camden-wide piece of work, which is the integrated care partnership. Again, Don alluded to this, and this is about how do organisations from health, social care, voluntary sector, patient engagement all come together to kind of deliver transformational change to services across a whole borough patch, and obviously that then supports a bigger population in this circumstance between 200 and 500,000 people. And then above that, you've got the integrated care services, the system. So that is a bigger place-based piece of work. As Donna alluded to in her slides, it's about how do the 5 boroughs of Camden, Barnet, Enfield, Islington and Haringey, how do they work together for more on a long-term strategic perspective to be able to deliver economies of scale across a larger population, rather than that kind of smaller place-based neighbourhood approach. So those are the three levels to integrated care as the NHS sees it. I won't spend too much time on this, but again, this kind of gives you another view of that process. So on the right-hand side, you can see this nice graphic here of the 3 different levels with, and they relate in colours. So the maroon colour is the neighbourhood element. The purple colour is the ICP, the integrated care partnership. So that's the Camden-wide piece of work. And then in green is the ICS piece of work. And we've got some really good kind of detail on what they are trying to achieve above them. I won't spend too much on this stuff. This stuff is nothing new. So we talk about it in strategic documents over the years. So how do we ensure that our residents, they live a longer and healthier life? How do they stay healthier for longer? So putting off the length of time, or increasing the length of time that they stay healthy before they start to develop long-term conditions. How do we really work with residents to understand what is it they want to do, what is it they want to achieve with their care and their health and other areas of their life that gets the best for them. So improving the experience of people's use of services and what they get out of it. And I think these are strategic documents. We see this again and again in strategic documents, and so I won't spend too much on that. And what I will say is just quickly, so if we're talking about that level above neighbourhoods, so I wanted to give you another slide. So these are the different organisations who make up the current integrated care partnership. So you can see we've got the council are on board there, along with the CCG. We have our big hospital trusts, Royal Free, UCLH, the Camden Islington Foundation Trust and CNWL. We have some home care providers. We have some voluntary organisations on that board. We have the GP Federation, so we've got some primary care input. And we've got Healthwatch Camden and others helping us to understand that resident perspective and help us with our engagement perspective. So you can see that that's a wide range of organisations working together in an integrated way to think about how can we deliver services in the future in a more collaborative, more coordinated way, rather than in a more individual. I suppose one of the traditional ways is to split between the commission and the providers boards being quite separate, and actually thinking about how can we join that up a lot more, so we're working together. So those.
1 minute, Tom, please.
Okay, I've only got one more slide. And so what the ICP, the Integrated Care Partnership, has done is it has set a vision for the future. And there are 5 areas of work, one of which we're focusing on today, that they want to focus on in the future. And these are here. And the one that we're obviously focusing on today is community connectedness. So I think that for yourselves as voluntary organisations, it's about within that piece of work, how can we use your expertise? How can we join up with your services much more in a coordinated way, so that actually you become a bigger voice for this piece of work and understand what is it that we want to help people with in their communities to be more connected, and how can we use your expertise in a more coordinated way. And sorry, these are just the other 4 areas, but we won't be focusing on them today. And that's it for me.
Great. Okay. Thanks very much, Tom. So unless there's any urgent questions, let's go straight to Jessica. So Jessica, can you share your screen? And
Apparently I'm still muted. I clicked on mute. Can everyone see my slides? Great.
yes.
Good.
Yeah.
Thank you. Apologies. Technology is not my friend. But it's lovely to see you all today. I'm Jessica Lawson. I'm the Prevention and Wellbeing Service Manager in Adult Social Care. So I'm here to really briefly give you an overview of Adult Social Care's approach to neighbourhoods. So it really starts with supporting people connected communities. So that's our strategy for living and ageing well in Camden. And that was first published in 2017. This set out our commitment to work in neighbourhoods and to taking that strength-based approach to how we work with residents. So that's really to help people to live as independently as possible, and with the support that's right for them at the right time. And we call this approach our What Matters approach. This is built on the idea that everybody are experts in their own lives, that they have their own strengths, they have their own resources, and with some support and some connection, they can retain independence and live a good life. So to help us better take this strength-based approach and focus on what matters to people, we did things like restructured our adult social care support and safeguarding services so that they're split into neighbourhoods, so that we can better sort of connect with people at that neighbourhood level. I've included a table in the slides about how we broadly split our neighbourhoods in adult social care. So some examples, some tangible examples of how we've been sort of working with neighbourhoods. Walk the Mile moment. So that saw our practitioners walking around their local areas, making connection with local organisations within them to really kind of build those relationships at sort of the ground up. We also sort of took an approach of linking in with cross-council voluntary community sector organisations, and this is important because we felt that that those organisations had links to local organisations that adult social care didn't have, and it was important to kind of make connections through them as well. So very good example are Age UK Camden and Voluntary Action Camden. We also recommissioned our home care provider contracts to make them so that they were commissioned on a neighbourhood basis, so that they could respond better to what is in the neighbourhoods and people's support needs within those neighbourhoods. In 2020, we have, in fact, refreshed our Supporting People Connected Communities strategy. This is kind of built on the fact that we have achieved a lot since 2017, but they're also reflecting that there's been considerable change in that time since we first published the strategy. Obviously, most noticeably a global pandemic. COVID, I don't need to tell you, has the dramatic impact on services and communities. And we felt that we needed to relook at our strategy to refresh that and refresh, you know, what we were going to do going forward, based on sort of where COVID, what the landscape of COVID was telling us, basically. So we have now got a new set of overarching principles and priorities refreshed in the refresh strategy, and I believe the refresh strategy is in your papers, your supporting papers today. And these really will drive the next phase of the adult social care transformation. And the priority areas are obviously how we connect with communities, how we really take that early help, that preventative approach, to give people support at the right time and support that's right for them, and the commitment that any plans that we develop will be developed together. So we really want to connect with people, or continue connecting with people and organisations at that kind of local level, looking at things like how we can embed referral pathways across sectors, how we can simplify our front door, because I know a lot of people are telling us that the council front door is complex. How we can do better at sharing information, so people know who they need to talk to when they need that support, and developing the opportunities that come from these connections, and also ensuring that people don't fall through the gaps between services. Our mental health services are also looking at transforming community mental health services. They'll be taking a population and place-based approach to this, which will be embedded in neighbourhoods. And they're seeing that there will be lots of opportunities to connect with you as this work develops. Next slide. Great. So a key, you'll probably see this very familiar. Tom, we should have joined up on slides, but you see that some of it is the same. So a key way adult social care is progressing its neighbourhood and early help work is through the integrated care partnership. And I know Donna and Tom have excellently covered off the principles around this. And the overarching kind of strategies directing the work of the ICP. So I am not going to go into that. I would say that that adult social care is very committed to this. We are delivering our early help neighbourhood priorities through the community connectedness priority. We see those as very much aligned. And I believe Kevin, in his presentation next, is going to go through the community connectedness priority. So I don't believe there's any need for me to go through that in detail either.
No, okay. Thanks very much, Jessica, for that. That was very enlightening. So it's just falls to me now to sort of wrap things up and bring it back to our theme for today, which is the neighbourhoods, and how does that particular strand, community connectedness, relate to the neighbourhoods. Let me just... Okay, so just to wrap things up before we break into the groups, this is really relating what's gone before to our work, what we're doing. So this community connectedness strand of the strategy, how's that come about? Now, So if we were to think about, it's worth saying that this is actually quite a practical strategy. It's not the sort of thing where someone has dreamt up something high level and then you've got to work out how on earth to deliver. This has come out of looking around at what practical things are going on. And you know, there's been a lot of work in the borough done on social isolation. There's obviously we've got a care navigation and social prescribing system that's evolved over years and is now an established model. We've got we've had a community and VCS COVID response over the last 9 months, and of course prevention is something that the sector has always been involved in. So if we were to group our post-its on the wall together, we'd probably group them together, and then what links them? Well, they're things happening in the community. They connect people to each other and to VCS organizations, and they tend to happen locally. So that then comes together under this idea of community connectedness. So it's a fairly practical strategy that links what's going on the ground, brings it together under a theme, this theme of connectedness. It's evolved somewhat. It really focused initially on that isolation, social prescribing. So it's then we had 3 themes. The neighbourhoods were a theme. Supporting the shielded and vulnerable, that's the COVID response, was a theme, and social prescribing. And then that was expanded to include prevention, you know, which I think is a very, very logical thing. So all the things that we would want to see coming together are there. So I just want to wrap up really before we go into groups. Just worth saying that the integrated care system that people have alluded to, it's coming, and it's coming quite quickly. It should be in place by April. Now, probably we should have a separate session on that because it's really quite a major change. But I just wanted to pick out some bits of jargon that you'll hear, some of it familiar, some of it not so familiar. So place will be referred to a lot, and place means different things to different people. But we've got devolution and subsidiarity mentioned a lot. So that is the principle of bringing budgeting, decision-making, operations down to the lowest logical level. So getting that as close to people as possible. A new bit of jargon is provider collaboratives. These are going to be collaborations, but we don't know much more about what's envisaged there. And of course, co-production is mentioned again, familiar to most of you. So that's community connectedness. And so what we're going to do in the breakout groups now, I'll just pause in case there are any questions, and then these are the questions for the breakout groups. We'll break into, I think, about 5 groups. So we've got, what are the opportunities for health, social care and VCS to connect people with activities and services, and of course connect with each other as well. Other things that we should be doing as the VCS to engage with this agenda, engaging with the council, with through the NHS, Health and Wellbeing Board, other routes, and then finally things that you want VAC to do to help you engage. So I will stop there. And first of all, are there any questions on that people want to raise now? I mean, obviously we'll come back together after the breakout groups and have a full plenary there. but if anyone has questions now, no? Okay, so let's break into groups now. So what I'm going to do is move you into groups, and there will be one of the speakers or a BAC staff member to facilitate each group. So if you can, we'd like to have a summary of what you discussed, ideally posted in the chat when you come back, and also if you could feedback to everyone. And we're going to do that. We're going to give you 20 minutes in the groups. I think everyone is back. I hope you had a good discussion in your group.
Yeah.
And what would be good if we could just have a really quick 1 or 2 minute summary from each of the groups. Diane, can I pick on you as I jumped into your group? So we'll start. I know, and it was an interesting group because we had Henry, who is involved in citizens' assemblies and the Health and Wellbeing Board, and we also had Tilly and Karen from North London Cares and Heath Hand. So groups we know well from social prescribing and that kind of thing.
Yeah, we were just kind of having a sort of very general discussion. Sorry, Kevin, we didn't get to many of your questions because I feel like it was such a complex thing. You know, we can't kind of right the wrongs of the world in 20 minutes, but you know, we were talking about all the different, please guys, interrupt me and add stuff as well. I was trying to make some notes, but basically just in terms of the neighbourhood level and all the things that are going on and how we can find a way to actually connect all of this work and all this great communication to strategically. And we were just, I mean, in the end, we were talking a lot about COVID and how that exposed how a lot of all these different groups were doing all these fantastic pieces of work and just getting on with things. And we've got all these sort of strategic boards, and they're all doing different things. The Health and Wellbeing Board, and the inequalities and disproportionality board, and the local care partnership board, and all these kind of. And actually, my big thing is always that, you know, how are we talking to these communities, and how do we get the voices of these communities directly feeding back at that level. And I think COVID kind of really exposed all of those weak systems, and everybody was kind of working in silos and doing all these little pieces of work. But actually what we need is an actual response where, you know, if something like, you know, not like COVID, but something like this comes along again, we're ready to respond in a very sort of coordinated way.
Yeah, okay, thanks, Diane. And yes, I think that whole neighbourhood thing, was it a web of connections? Was it about neighbourhoods, or was it more a sort of web of connections? But thanks for that. I'm going to go to Donna's group.
Okay, so we got it into 3 main points. I think our group was Zubair, myself, Sinead from North London Cares, and Paul from Holborn, who's had to leave. Okay, so the first thing was about relationships. The point was made that a lot of the engagement really for the voluntary and community sector organisations is going to be on the ground where they're providing services and activities and opportunities, and having some key contacts in health and social care for when residents need that sort of extra support, the residents they're working with need that extra support, would be really useful. So the other thing was about commissioning and having a much better understanding of voluntary and community sector, the offer, I suppose, and that it's not like straightforward service delivery. So bringing commissioners nearer to the sort of ground really, and having a better understanding about what all those activities and services and opportunities for residents are. And then there was something about data. So how to be better at sharing data, funding it, structuring it, and telling the stories around it. And there was an ask there for possibly Volunteer Action Camden could do something about that. So what are the stories that work around data to have influence? And I think, yeah, that is possibly something we could do. Okay, that's us.
Great. Okay, thanks, Donna. Tom, we go to your group.
Hi all. So on my group was Kate, who's the HCA Befriending Scheme Manager, Len, who's a volunteer at VAC, Naomi, who's a Community Care Link worker at Holborn, Brendan from CDA, and Naomi from the Winch. So on the first question, I think a couple of things that we picked up on, first of all, was around a question that the Winch are asking is, who's the person or who's the point of contact that people first go to when they feel they need support? And I think that the feedback from the group was that often that isn't a health or care organisation or even a voluntary and community organisation, it's friends and family. And so there's something there about understanding why people maybe don't see voluntary organisations as that first point of contact, and actually giving people, whether it be the person themselves or whether it be those friends and family, the kind of confidence to reach out to organisations in the community to help them with the support. I think the other thing that we kind of spoke about was what we meant by neighbourhood, because we are obviously describing it in one way, but every person's sense of place and sense of community is different, whether that be a region, a geographical region, or whether that be a single a state, for example. So people's understanding of what community and neighbourhood means, and therefore what's available to them activity-wise in neighbourhood, will be different. And so I guess getting that right and understanding that is important. On the second question about engaging with the agenda, I think one of the questions that came back was that lots of voluntary organisations don't have resource and funding to be able to engage in this way. And I guess there was a concern from our group as to whether the voices of those perhaps smaller organisations get lost and don't get heard, and whether we continue to engage with those organisations who traditionally we have engaged with, and whether their voice kind of needs to be reflective of the wider voluntary care sector, to bring those into the piece. And on the last one, I think we spoke more about whether there was more work that could be done around kind of directives to services and joining things together in that sense. And kind of understanding there are so many organisations in Camden, and we don't know what everyone's doing and what their remit is and what their criteria is. So in terms of bringing that engagement together, where there's more work that could be done to bring that information together and make those connections, and have more of these events where we can actually make those networks and make those connections.
Yeah, great. Okay, thanks, Tom. And there sounds like an action for VAC at the end there. Fran, can I go to your group now? A couple of minutes from you.
Yeah, actually Tom's and other groups had covered similar questions. So I guess the one about representation and representing smaller groups that don't have capacity to attend these meetings was very much voiced in our group, and with also some thinking about how can we ensure that these conversations are shared with staff and board members of organizations, so that the sort of understanding and awareness of how these conversations are moving forward is actually shared across the organization and not just with senior managers or those that are engaging directly. The other thing that was flagged was about the language that sometimes these strategies and plans use that may, I mean, someone said in my group that is important to remember to be human and kind of focus on that, the conversation rather than the system thinking and the system change, not because they are not important, but by bringing the human element to the front, you can steer the system thinking and system change in a way that is inclusive. I forgot to say who was in my group. We had Allegra from Camden Cares, we had Anna from Likewise, Orf as a community health champion, Mari Fee from Camden Let's, and Francis for CDA. Again, another vote for more of these networking opportunities and a better, clearer directory so that people are more aware of what each other is doing, especially given that community response to COVID had made many groups repurpose their services. So there is probably a bit of confusion about, you know, how much of what we used to know each organization does is still operating. A final that is linked to the Be Human, and I think is really a takeaway for the working group on the Integrated Care Partnership, is about really asking ourselves the question how all these changes and new projects and new strategies are actually making a difference for the local resident, and you know, what kind of change we expect the local resident to see in their day-to-day need for care or use of care services. So I think that was a really important point, and one that we might need to think about in terms of bringing that voice directly into the group.
Yeah, thank you, Fran. That's a really interesting question. At the end of the day, you know, how do the residents, users and members, what difference do they see in all of this? Interesting. Okay, Jessica, over to you. A couple of minutes from you, please.
Thanks, Kevin. So in my group, we had Michelle, who's a member pioneer of the co-op. We had Kathy, who's the trustee, Voluntary Action Camden, Mark, who sits on CPEG, and Dominic from the Camden Volunteer Centre. So a lot of things that have already been mentioned in other groups sort of came up. The need for communications, sort of clarity on communications, and maybe a kind of a central channel that can be filtered through. But how do we include everyone? Opportunities for digital in that space that have opened up, but also excluded people in that as well. So how do we bring people with us on that, and how we work. Basically, we're all very committed to working with residents, but how do we do that? How do we hear the resident voice in that? You know, sometimes people can't see the joy, and how do we ensure that happens? Dominic raised a very good practical example of Greenwich TCG doing a WhatsApp broadcast for people who want to sort of get those kind of short, useful information things that they can. So part of it, you know, a bigger comms strategy, but they can, you know, put out really sort of quick, simple, useful messages on that space that can be sort of shared elsewhere. Also, the moving on to sort of two, how we can use the opportunities, you know, how we can better sort of share those resources. So, for example, if you're DBS checking a person, is it possible to for them to move on to new opportunities, or share those resources, and sort of sharing things like training, the information on DBS checks. How can we standardize that process and make it easier for people that don't have access to those resources? and sort of there was a sort of a kind of a mention of peer support as being a good example, but mainly kind of looking at how we can sort of keep things practical, simple, welcoming and transparent across those things, because that's very clear in any kind of messaging and comms. So anything that Voluntary Action Camden can help facilitate in that front to kind of ensure that we bring it all together and those kind of messages are clear and everyone can kind of join in with that. There were a couple of wider questions that didn't really fit into those three things about sort of, and I'll mention them here, even though we've got 1 minute left. And I think they were more sort of, questions, Q&A questions. So it was about sort of who has the overall responsibility for integrating and co-producing this work, how kind of representatives of the voluntary community sector chosen, and who is accountable, and how this will work with everyone. And that really came out the fact that you saw all those priorities, not just the community connectedness priority, but the other ICP priorities, and there's clear dependencies between them all, and how can we kind of fit those all together so that you're not being invited to 100 different meetings, you're just being invited to one, you've just got one communication channel, residents are being contacted about one thing, so that messaging is really kept simple. And the other one was more about sort of how we can kind of connect commissioning at the local level.
Okay, thanks, Jessica. Well, some very big questions at the end there. We're running out of time. I mean, I did say that we would have some time for questions at the end. We seem to have raised an awful lot of questions. If everyone is okay, we could go on a couple more minutes if people have. Can I throw it open to the floor if we've got a couple of last minute questions that anyone wants to? I know the groups have raised many questions. And I think there's no
yeah, for me, I really take on board the fact that it's key to keep things simple, keep those comms channels open, keep everyone included, and look for ways that we can kind of simplify, make that transparent and joined up, so people don't feel like they're missing out, or they don't feel like that something works going on elsewhere that they're not sort of joined into that conversation with. And I've got no, I think that's a kind of an ongoing kind of developmental thing, but I completely take everyone's points on that.
Yeah, okay, absolutely. I mean, I think that I've taken away, certainly there are actions for VAC, certainly in our CVS role of connecting things up, networking people around, getting messages, information, being a conduit to and fro. That sounds like something really important and really important to get right, so that people aren't left out. And that's going to be a challenge for us, because it's a large and sprawling sector, and it doesn't have to all fall to us as well. I suppose it's about getting a clarity. It's not a it's more of a web of connections than a sort of straightforward maybe hierarchy of a system. And I think that we've talked in our group about the challenges of getting that sort of the voluntary sector web of connections connected into the public sector, which is a bit more clear. Although I have to say, in this agenda, we're swapping places maybe. The public sector agenda is not quite so clear, but this integrated care system is coming. It's coming down the track, in theory, 1st of April. So I think watch this space. There will be a lot more happening. I'm going to wind things up now if there are no pressing questions from anyone.
Just Kevin, just a quick one. If the presentations could be shared with a group, I guess.
Sure, and we will collect up the notes from all the groups as well. So and then we will put that all together, and that will all go up hopefully in the next few days with the presentations, with the background reading that we've got, to give you hopefully a picture with a little bit more clarity. Okay, so it just remains for me to thank you all for coming, and a big thanks to all of our speakers today, to Donna, to Fran, to Tom, and to Jessica. Thank you all for coming. I hope you have a safe and restful Christmas and New Year break, and we will see you all back in the new year. Our next forum is on the 16th. So we'll hopefully see you then.
Thank you.
Yeah.
Thank you.
Thank you.
Bye-bye.
Thank
Bye,
you.
everyone.
Good catching up. Thanks. Bye.
Bye.
Thanks. Bye.